So our next session is by Dr. Nina on how is your memory. Okay, so Dr. Roshaslina is the CEO of Aqua Health, an evidence-based company promoting healthy aging. She converted her master's and received her doctorate of philosophy in medicine from University of Malaya in 2019, focusing on establishing effective tools for the assessment of dementia among senior citizens in Malaysia. She holds a degree in biomedical science and a diploma in medical lab technology from Management and Science University. She has special interests in dementia prediction, care, and management. Apart from managing her company, she also works under the National Institute for Health Research Global Health Group on Dementia Care and Prevention, research funding looking into dementia's policy making in Malaysia. Previously, she was a postdoctoral research fellow in conducting research on dementia care pathway in Malaysia. She has presented many of her research findings both locally and abroad as part of the Aging and Age-Associated Disorders Research Group, as well as the Dementia Care and Prevention Group.
Okay, thank you so much again to Kitara and to all of you to spend your weekend for our event. My name is Dr. Roshaslina. I'm more appreciative if you can call me Nina because that makes me more excited. Okay, so for today's, I'm going to talk about how is your memory, and from our pre-webinar survey, so we have most of the question and majority asking about this topic, especially focusing on dementia. So let's go through this. Okay, so now, did you know that 1 in 20 of the Malaysian above 65 years and above actually suffer from moderate to severe dementia? Like being shared by Dr. Hasif in the earlier presentation is that most of the people with dementia, they actually will suffer from memory problem, cognitive problem that may affecting their speech, the intellectual thinking, and also may have changes in the mood, personality, and behavior. Okay, and as the individual age, they often being experiencing some difficulty with the memory. But how can you tell the difference between normal aging, dementia, and Alzheimer's disease? Because dementia and memory loss are closely associated, but although similar symptoms can appear with various types of memory challenges, there are some significant distinctions. Now, the question is dementia a normal part of aging? Okay, no, it's not. You need to bear this in mind that it is not normal part of the aging, because dementia is a progressive disease that causes cognitive function to break down abnormally, which may cause cognitive and physical symptoms to get worsened over the time. And whereas for the normal aging, it is much more minor, where you can see with changes resulting from a natural lowering or decreasing in efficiency in the body. So that's the difference. And also, like in the normal aging process, the brain and the body, like I mentioned just now, it begin to slow down, but their intelligence level are remaining relatively steady. So you and your relative may begin to experience some changes in memory that can manifest as trouble in recalling name or in remembering the places or people. And you also may find that it is take longer to register certain information, and that mental and physical flexibility decreases. But in dementia, on the other hand, it has more frequent and destructive symptoms. So now let's look at this. How can you tell if memory troubles indicate dementia and needs for memory care? Because it's not just rather than typical aging. So here is the comparison from the normal aging versus dementia, where the person in dementia, usually you will see that they're having a problem that not remembering the names and the event of friends or relative, someone that close to them. And then also they have a frequent in forgetting appointment and event, or even though now we have the Google calendars and all the reminders in our phone, but this is the most obvious one that you can see, and their orientation as well. They also have a trouble in verbalizing thought when they're talking, and even when they do conversation, also they have a frequent pauses, and they may try to substituting common words, which is the one that they usually use. And also they will have a regularly repeating statement or question asking you many times, and they may have a consistently misplacing item. They forgot where they put all this item, which is very different compared to the normal aging. And other dementia symptoms that we need to look out for is they have a frequent confusion or have inability to focus. They have a very short span of attention, and also they can becoming lost in a familiar places, and they will have the mood changes like mood swing like that. Okay, now. So many people think that dementia constitute a diagnosis in of itself, but it's actually describe a set of symptoms that result from several different disorder of the brain. So if you can see here, the brain function, there's various function of our brain. So the symptoms that dementia cause is revolve around the mental deterioration with the level of severity that affects the sufferers in their daily life. So if you begin to experiencing dementia, you may notice the sign in a variety of a different brain function. For example, you have trouble in recalling, understanding a symbol of map, the simple symbol, in writing, speaking, reasoning, solving problem, and other comprehension issues as well. So comparing again the normal aging and dementia in focusing on the loss of the nerve cells, the adult may experience a loss of nerve cells in normal aging and dementia, but at different level of severity. Because the loss of nerve cells in normal aging is actually minor and is combined with the nerve cells passing message slowly. So this causes people to take longer to process their new information and recall the old memory. The impairment is typically subtle and does not cause difficulty with daily tasks or independent living. On the other hand, for dementia, it is with the loss of nerve cell may impacting the ability to think clearly and solve problem. So how soon and how severe of the loss of the nerve cell is in dementia, as well as the symptom it causes, is actually varies based on the type of dementia the individual will have. Okay, so now, so you heard of dementia, but you also heard of Alzheimer's disease, right? So is Alzheimer's disease different from dementia? Okay, so you heard a lot of Alzheimer's disease because it is the most common types of dementia. Because over time, the disease causes damage to the brain nerve cells with symptoms, and the worsening as an increasing numbers of cells suffer damage. So Alzheimer patient often initially notice symptoms like forgetfulness that can affect their work and home life. Unfortunately, at the moment there is no cure for really specifically on dementia, but the treatment can help to control the disease. So especially when it is diagnosed in the early progression. So I think this is one of the questions that being asked in the pre-webinar survey. Okay. Then the next type of the dementia is vascular dementia. Is the most second common type, which is include problem with the focus, confusion, and memory loss. And the changes can occur gradually or suddenly. So in some cases, a patient may experience a rapid changes followed by a period of stabilization, and the development of the vascular dementia can be linked to the chronic illnesses like diabetes, heart disease, high cholesterol, and also high blood pressure. The next one is the more rare form, which is a frontotemporal dementia, which is typically impact the side and the front of the brain, and it often occurs in younger patients. And next one is the Lewy body disease. It is a form of the dementia, which is a protein become deposited in the brain nerve cell, which is cause the symptoms such as impaired in judgment, confusion, and also have trouble with memory. Now, we need to understand on the risk factor for dementia so that you can help to determine if you or your loved one may need a medical evaluation. So research shows that the risk factor for dementia is a diabetes, heart disease, and high blood pressure. Other than that, it's because of the stress, depression, and other psychological issues, and also because of genetic. the DNA that runs in the family. Okay, and also because of the suboptimal nutrition, which is less than or higher standard of the quality of dietary. Now, how to tell if someone has dementia? Okay, because if a friend of the family members is showing a sign of memory trouble, how can we tell if the problem is from the dementia or it's just because of a simply a normal effect of aging? Okay, so this I would like to share. Okay, so this is a published paper that the work that been done from 2014 to 2016, where we publish our data on comparing and to see how to best to screen for the cognitive impairment in Malaysia. So here in this picture, this is all our, yeah, they are very nice. I miss them. Okay, this is all our participants for in that study, where we go to their home and we test them in their home environment so that we want to make sure that they feel comfortable and they feel at this at the the usual familiar places to screen their mental condition. And then we also do put some visual aid for sorry, not visual, the hearing aid for the participant that may have the hearing impairment. Just all this to control the validity of our result. And from here, other than doing this go to home, actually this one is a PPR, so it's a flat. And sometimes the lift is broken down, so we need to climb all the stairs. So all that is a memory. And other than that, we also do some health screening, where we call all of these senior citizens to come in one place, and they will gather, and we will do the memory assessment there. Other than we testing the memory test for the tools for among the senior citizen, but we also check among the professional surveys, the allied health, because they are the one who will administer the test. So we do the face validity, means that we want to see whether how they feel about using that tools or that assessment when they want to check for the memory condition. And also, I would like to share, I always like to share this picture. That is actually Prof. Tan. She being ambushed by these all furry creatures. This is one of the patient home that we went. I don't know why I just love this picture. Okay. Then other than that, we also publish this systematic review, where we put all together all these screening tools that are available in Asia in detecting dementia. So then from there, the published articles are being presented in lots of platform in a conference, and we share this for international and national level. And other than that, not to mention that our tools that we use for the memory test in Act for Health is actually being used in our National Health and Mobility Survey in 2018 for the elderly health. So here you can see that that the tools that have been validated are used in a Malaysian setting. So it really shows that the usefulness to be used in our populations. So then with all the hard work there, here is come with our product, which we come out with the memory test that includes all the memory tests that been validated in Malaysia, especially for our own population. Now, that's about the screening or to test the memory. But then now the question is how to care for your loved one with dementia. Because following the detection of dementia, often they progress through three distinct phases, which is mild, moderate, and severe. So as the disease moves into the moderate phases, your loved one may require more assistance with activities of daily living that may include like their personal hygiene, for example. So at the moderate phase, you also may begin to feel challenged in providing care. And as the dementia progresses to the severe stage, your loved one may experience very limited mobility and problem with eating, drinking, toileting, that all the require the constant care. So that is why here is a complementary from our services in the memory test. We provide individually tailored activities, this brain exercise, to increase or to maintain the cognitive and social functioning to ensure independent living. Because from this service, we aim at general enhancement of the cognitive and also the social functioning that they need, and to live independently as long as possible that we can. Okay, so the brain exercise, we are using the module of cognitive stimulation therapy. It is being conducted by occupational therapists. Okay, so this cognitive stimulation therapy is a brief, evidence-based treatment for people with mild to moderate dementia. So it was designed following extensive analysis and research evidence and has been evaluated in worldwide. So has since been evaluated internationally and has been found to improve general cognitive function, language comprehension, and production of the quality of life. And also, not forget to mention here is that there's also publication that been published that using this cognitive stimulation therapy to our own Malaysian elderly. So each session of the cognitive stimulation therapies follows a general theme with choices of activities and can be customized in order to cater the needs of the individual or group. So it can be conducted in with one person or in a group of the session. So the session will be conducted by occupational therapists where they will begin with a warm-up activity and a reality orientation. So some of the examples that being used for the session is like physical games, sound, childhoods, and the other in the list that you can see in the screen now. So the other activities that can be put into this session, they can use a boarding card game, a cross puzzle or Sudoku, and if to focus on language, maybe they will do some written or spoken social interaction, playing with musical instrument, and also do some daily life activities, working on a regular job. So even though that we already have, we provide all these services, but we need to understand that what we can do is only on that session, but your loved one may live with you in the most of the daily time. So some of the things that we would like to share is like how to maintain and improve your memory, of course your love memory as well, your loved one memory. It is to learn something new. For example, like you can learn new instrument, new language, or dancing, or new skills, which is one that you never done it before. Okay, learn something new, and you need to do some repeat and retrieve, which is mean that by repetition, you will reinforce the connection that we create between the neuron. So by repeat what you heard, what you hear out loud, and try to using it in a sentence, you can try to write it down and try to read it loud. So the repeat and retrieve is very useful. And next is don't turn to Google right away, because yes, we cannot resist that everything now we have a smartphone. They always remind us about our meetings, our appointment. So we're not using our own brain for this. We just leave everything to technology. So try to not straight away Google or straight away depends on technology that we have. Okay. And the next one is about eat more of these foods, which is a Mediterranean diet that includes these foods may improve the ability of the memory and reduce the risk of Parkinson disease as well, and also the Alzheimer disease. And other, for example, is that fatty fish with a rich source of omega fatty acid, which is because this omega-3 plays an important role in building the brain and nerve cells. So they are essential for learning and memory and have been shown to delay the progression of the disease. So other than that, we can't say that only the brain exercise, but the physical exercise. So like have been shared by Dr. Sumaya just now, having a physical exercise is also helpful for your memory. Okay, not only memory, but your whole cognitive function. And you need to manage your stress because it's known as the most of the risk factor may contribute to the memory slow down, and you need to socialize. Okay, so I think that's the most easiest one to do, where you can keep yourself updated with the current things and situation, but not to update about things that may stress you out. Think about the things that may make you happy. Okay, Then, as a carer or as a family members, or when you're taking care of your loved one, how you can help them. There is some of the basic things that you need to focus on. Okay, you need to help them with the everyday tasks, where the memory aid, you can use the memory aids around the home that can help the person to remember where the things are. For example, you can put the labels or sign on the cupboard, drawers, or door, and then you can help them with eating and drinking, because eating a healthy and well-balanced diet is important part of the healthy lifestyle for everyone, especially for people with dementia. They may not drink enough because they don't realize and they don't feel thirsty. They also forgot if they eat or not, so you need to help them with that. And also you can help with the incontinence and using of the toilet. So because people with dementia may often experience problem with going to toilet. Yeah, they sometimes they forgot where the toilet is. So that's why just now the first point that you can put the direction, or so that they know where the places is. You need to help them with washing and bathing, because like oh sorry, yeah, okay, because when when they are demented, they don't know how to take care of themselves, so you need to help them with it. And of course, other than that, even though we are focusing on our loved one, but you need to look after yourself as well. Because carrying a partner or relative or close friend with dementia is demanding and can be stressful. We do understand that. So it is important to remember that you need that your need as a carer is also same as important to the person that you're caring for. Okay. So the last one is I would like to share in this session. So in addition to all of the other services we have, like the memory test, the brain exercise, it comes to related with this home hazard assessment as well. Because if your loved one is live with you, and your home may require some changes like removing of tripping hazard, you may need to installation of the brighter lighting and additions of the safety latches on the door. Okay, you need to make sure that your home environment will be professionally assessed. Need you need to be professionally assessed by expert. Is in order to adapt or modify your home environment towards the lower risk of falls as well. Okay, like been shared by Prof. Tan just now. So with that, I would like to thank you for watching. I think we are watching the screen now, right?
Thank you so much, Dr. Nina. Ms. Sharifa has said this program has focused on falls and cognitive health. Does Act for Health focus on the same or include overall health and well-being, perhaps in the future if not at present? And number two, what linkages, if any, to the geriatric and memory clinic services at UMMC?
Great. Actually, the focus, the apparent focus on false and cognition is not is actually purely accidental. It's just that the two of them are the most prominent condition that affect our older people today. So with the 5-point screen, we intend to actually pick up the most common uh, problems that are actually affecting our older people. That is cognitive health, frailty, false risks, um, and also general kind of deterioration. We call it failure to thrive, which is quite common in older people. We don't know quite what is wrong, but they're just not right. So that and cognition and false risks and physical weakness all feature very prominently in these. So with regards to integration with UMMC, yes, our products were based on research primarily that has been developed from the University of Malaya, but we do not intend for it to become uh, entirely linked to the UMMC service, because the whole point of this service actually sprouting out is to actually offload our oversubscribed services. We have an 8-month waiting list for memory clinic, nearly 4 or 5 months for the falls clinic, because we work very hard at cutting down the waiting list, because falls is a sudden event, we can't wait so long. And then for geriatrics clinic, definitely yesterday I tried to make an appointment and I got one in May. Yeah, so that's how long it takes. So what we're trying to do is offload the service. So to feed into the service would be kind of a little bit counterproductive, but it will act a bit like a sieve, I suppose, a filter. But if we do identify someone who's living in the vicinity of the UMMC, or who would prefer to see a geriatrician in the UMMC, and they have an urgent issue. Like the other day, this older person got lost wandering, so we actually made an urgent appointment for them to be seen at the memory clinic, because wandering and getting lost is an urgent indication to be seen by a geriatrician. You do not want to wait 8 months. So we can filter and help prioritize to the service, but what we're trying to do is to actually offload the service, so not people do not actually need to use the service at all if possible. But if we do detect anybody, we do not just feed to UMMC, we actually educate them about the whole wealth of the services available throughout Malaysia that they can access.
Okay, thank you, Prof. Tan, for uh, answering Ms. Sharifa's query. Anyone else has any other questions you would like to ask? Dr. Nina, is there any other questions from our pre-webinar survey that you would like to address? I can
Yeah.
read them.
Yeah, actually, because most of the question I've already included in my presentation, and hopefully that is answered the question.
Okay. Ms. Sharifa, again, the brain exercise products, is it available for purchase?
Available for purchase. Okay, now it is available in our center because it is being conducted by our occupational therapist, which is being trained to do that cognitive stimulation therapies, and she knows how to handle the session. So sorry, maybe you can explain more about the question. Like the purchase mean here is that you want to practice it, or you want to practice the module, or what?
This is Sharifa. No, it's actually to see if it's available for me to purchase and use it to my mom.
Oh yes, absolutely.
Yes.
Yeah. Yeah. We do have the two kind of session, whether you can
Great, thank
do
you.
your mom whether you can do it for your mom individually, or also she can do it in a session in the group. So we do have that service to available.
Okay, thank you.
If everyone is okay, we will proceed to the very exciting segment we have after this, just a little bit more.